Good morning from Singapore, ladies and gentlemen. A very warm welcome to Leaders Dialogue, Transforming Healthcare with Deep Tech Innovations. My name is Joy, I'm the CEO of SGInnovate, and it is my pleasure to open today's virtual event jointly organized with the Federation of Indian Chambers of Commerce and Industry. Quick word on SGInnovate, for those of you not familiar with us. We are a company that's wholly owned by the Singapore government, whose mandate is to develop the deep tech ecosystem. And we do this by investing in deep tech startups, developing and placing talent, and bringing people together like we're doing today. We believe that in addition to education and raising awareness, discussions like the one we're about to have also serve as an important precursor to eventual action. Let me also just touch very quickly on deep tech, since we're talking about deep tech innovations. For SGInnovate, deep tech refers to technologies derived from cutting-edge science that require a high degree of specialization at the point of invention and application. So think space technologies, think artificial intelligence, or even mRNA vaccines. One of the most breathtaking features of the pandemic, and I'm not saying anything that none of you don't know, obviously has been the incredible innovations that have arisen in response to it, whether it's diagnostics, vaccines, therapeutics, contact tracing, health passports. Many of these innovations are rooted in deep technologies. In Singapore, the startup community has begun to make its presence felt in this battle with the virus. Just 2 days ago, the Changi Airport Group announced that it was working with a company called Silver Factory Technologies on a COVID-19 breathalyzer. This follows innovations that are geared towards moving testing away from requiring a blood sample. So there are other companies working on saliva testing, for instance. We have a portfolio company, Biofourmis, that developed an AI-powered monitoring platform that detects early deterioration in COVID-19 patients. And Singapore's leading digital health passport is something that was jointly developed by SGInnovate and a company called Accredify. And it uses a blockchain-powered solution to issue secure tamper-proof COVID-19 medical records at scale. So the question is, that we want to talk about today is really about adoption, how large healthcare systems have been adopting technologies in the wake of the pandemic. And, and I suppose the question is whether we've seen clearly adoption of these technologies in various degrees. And I suppose the question is, whether this heralds the dawn of a new age of technology adoption by large healthcare systems that will transform them. And if so, how that might happen. What are the considerations on the healthcare system side? Of course, the startups all want their solutions deployed, but what are the considerations on the hospital system side, right? What are the requirements for something to be deployed? What are the challenges that the startups are likely to face? And to answer those questions, we're very, very privileged to have two giants in their fields join us today that will give us a perspective from the private sector as well as the public sector, from India as well as from Singapore. We are very privileged to have Dr. Sangeeta Reddy, who is the Joint Managing Director of the Apollo Hospitals Enterprise Limited Group. Sangeeta is also a well-recognized global healthcare leader and entrepreneur, and an entrepreneur as well. From Singapore, we have Professor Kenneth Quek, who, in addition to his role as Chief Executive Officer of Singapore General Hospital, which is the largest hospital in Singapore, he's also the Deputy Chief Executive at the group level, at the what is called the Sing Health Group, which encompasses a variety of other healthcare provision services over and above Singapore General Hospital. And at the group level, he's the Deputy Chief Executive Officer for Organizational Transformation and Informatics. Now, before I hand this over to Navita, who also is going to say a few words, I just want to add that Dr. Reddy, in view of the situation in India, has requested to be to leave the conversation a little bit earlier, and it is a request I intend to honor. So what we will do here is, after the introductions by Dr. Reddy and Dr. Quek, I would suggest that I'll begin with my conversation with Dr. Reddy, and then at about 9:30 India time, which is about 12 noon Singapore time, we will start taking questions for Dr. Reddy, if there are any. And thereafter, Dr. Reddy, you're free to leave, and then I'll continue with Professor Quek. Now, let me hand you over to Navita from the Federation of Indian Chambers of Commerce and Industry. Navita is going to say a few words as well. Navita, please.
Thank you, Dr. Joey. Thank you so much. Good morning, everyone. On behalf of Federation of Indian Chambers of Commerce and Industry, we are pleased to be here today partnering with SGInnovate for this very special Leaders Dialogue on transforming healthcare with deep tech innovations. Not taking too much of your time, when we are blessed with the esteemed presence of such esteemed panelists from India and Singapore. I will briefly just give you an overview of FICCI, and then of course I'll request Dr. Joey to take it on forward and start with the discussion. FICCI, or the Federation of Indian Chambers of Commerce and Industry, is India's largest and oldest association or trade chambers in India, established in 1927 at the behest of Mahatma Gandhi. And we are the voice of India's industry and catalyst for policy change, working across 70 different sectors and reaching out to close to 250,000 companies across India, with the composition of Indian as well as global conglomerates based in India, as also the multiple state chambers and associations which are members of FICCI, being covered through 19 state offices that FICCI has in India. And of course, we also have 8 international offices, and I represent FICCI in Singapore. Healthcare is a very important segment that FICCI covers in India, and we've been blessed and we've been honored with Dr. Sangeeta Reddy's presence as our president also as of last year. So she's also our immediate past president. And while there have been a lot of strides that have been made in the healthcare sector in India, I think the COVID-19 pandemic has shook the globe with all its impact, and FICCI has been working very extensively in India with the Indian government, engaged with various ministries, with NITI Aayog, WHO, as well as the empowered groups under the Disaster Management Act 2005 through policy intervention, through sharing strategy papers, as well as facilitating logistics and mobility through its various health sector committees. And briefly, just to give you an overview, we have been very, very active in this area. And Singapore and India, I think if you're looking at it from the prospect of a cooperation, digital health and technology is one of the pivotal areas that we think we can cooperate in, we can work together in delivering value-based care across the healthcare continuum in India, as well as in Singapore. So on that note, Dr. Lim Joey, back over to you to please take it forward. Thank you.
Thanks, Navita. So may I now invite our 2 speakers to give a short introduction of yourselves and the organizations that you work for. Let's start with Sangeeta, please.
Good morning and namaste. It's a pleasure to be here, and I appreciate the great work which is being done by all of you. I am from Apollo Hospitals Enterprise Limited. Apollo Hospitals was started in India about 38 years ago. Today we span over 10,000 beds. We have a presence in different perspectives of healthcare, including the high-end tertiary care with advanced equipment, in that we also have over 4,000 pharmacies, a significant play in all aspects of education, whether it's a medical school, 14 nursing colleges, an online training company called Metacity, as well as a skilling company. We also work in the area of diagnostics, of clinics and primary care, of ambulatory care and day surgeries, as well as technology, and have now really launched approximately a year ago one of the most engaging digital platforms called Apollo 24/7 to help us connect our consumers to high quality healthcare in a manner which is convenient to them. I'm Joint Managing Director. I have a role to play across many of these initiatives, and I firmly believe that we must continue to do more to make healthcare proactive, focused on prevention, more personalized, and as friendly and as humane as possible, empowering the customer or the healthy individual with everything that they can do to stay healthy, while at the same time find ways to bring advanced healthcare within the reach of everyone using a universal health insurance coverage strategy. Thank you very much.
Thanks, Dr. Reddy. Kenneth?
Hi, morning, G. Morning, everyone. Thanks very much for tuning in. And I must say it's my pleasure and privilege to be here. And thanks very much, Dr. Sangeeta, for sharing. I love the name that you gave for platform, Apollo 24/7. It's just so fitting, right? But I'm Kenneth. I'm an obstetrician by training, specializing in maternal fetal medicine. I'm currently with Singapore General Hospital, which is the largest hospital in Singapore. We have, well, before the COVID pandemic, we were running 1,700 beds. Today, we're running close to 2,000 beds because we had to increase our capacity. It's a little bit unusual because we were planning this year to have a lot of celebrations, because if you see the number behind me, 1821, that was the year that the first hospital was formed in Singapore, and we are actually celebrating our bicentennial this year. So SGH turns 200 years old this year. But we've had somewhat muted celebrations. But that doesn't distract from the fact that we're very proud of our history, and that history has sort of seen Singapore through some really tough times. Previous pandemics, previous catastrophes, and major incidents, and we've always stood with the country. And I'm very proud of the way that our people really have risen to the challenge and continuing to battle the COVID-19 pandemic. SGH is part of a larger cluster, as we mentioned earlier, SingHealth, which is short for Singapore Health Services, which is actually the largest of the three clusters in Singapore. And we continue to strive to provide the best outcomes for our patients and the best clinical experience and patient experience, really, while they receive their care. Of late, particularly over the last 3 to 4 years, we've been exploring ways to extend the care beyond our hospital, beyond the healthcare system, into the community and into the home. And I think that G was mentioning earlier about what are some of the trends that will emerge over the next few years. I'm quite convinced that that's a trend that will continue and continue to be a major focus, wherein healthcare will extend beyond the hospitals and beyond the healthcare system into the community and into the home. Right. Thanks very much.
Thanks, Kenneth. So let's get the ball rolling. Sangeeta, in the past year, what, in your view, has been the most impactful and effective innovations for you at Apollo, or India generally?
So I think broadly, India had begun on a technology journey with the National Digital Health Mission, with the National Health Stack, with the concept of universal health coverage. So the government was focusing on a lot, but I think India, like all other countries, was really caught, by the pandemic. And so coming directly to Apollo hospitals, and what we have done, we're able to do, or have found extremely valuable during these difficult times, was really, number one, the platform, Apollo 24/7. We actually had over 12 million downloads, have been able to make teleconsultation like a mainstream. So people who are worried are just able to dial up and get connected to a doctor, are able to order diagnostics. So whether it's the RT-PCR testing or anything else, because we have to remember that while we're treating the pandemic on one side, we also have all our other ill patients, cardiac patients, cancer patients. So this ability to reach out to their doctors and stay connected has been very powerful. That was one thing. The second thing I think, as was most appropriately referred to earlier, is the true explosion of home care. So we're currently treating over 3,500 patients through our home care division, and they are connected by devices, by a telemedicine overlay, by a personal health record where we're able to note all their critical parameters and proactively intervene if something needs to be done. So I think that's been a big one. The third thing is really just using innovation. We created a concept called Stay I, or Stay Isolated, where we converted hotel rooms into hospital supervised care. Again, using the mobile phone of the customer and a telemedicine overlay for most patients, a bit more well-equipped rooms for a sicker patient. We're currently handling over 3,700 individuals in hotel rooms in the Stay I project. And we have a central command station where all these patients are being monitored, and we're able to manage the protocols, the criteria for selection, monitoring, transfer to hospital, discharge, patient education is all so much easier than if we had not been in a tech-enabled world. And I think like that, I mean, there've been lots of innovations across, but the most, other one which I'd like to raise besides research and things we've been doing, but is the education aspect, because in a pandemic, you have to quickly be able to scale up and educate on new protocols, on new care plans. So whether it was, Microsoft Teams to connect our own teams, but also we've used our tech education platform and trained over 150,000 people in COVID care protocols. We did this completely free, and we've trained over 40,000 people in ventilator use. And here it's the program, there's the simulation, and there's a mentoring system with the Critical Care Society of India. So various new things have come into play because we've understood at least the power that technology has. But there's so much more to be done. I think we're all in it together. We should just keep an open mind and find ways to collaborate, but do it fast for the sake of the patient.
Can I just ask a question about Apollo 24/7? Did it precede the pandemic?
So interestingly, yes, it did. So you make the very good point that companies who were preparing with a baseline of technology were those who were able to respond quickly and pivot quickly into using these technologies during the pandemic.
So, I mean, no, that's really interesting because, at that point in time, the pandemic hadn't befallen us yet. So what were some of the considerations at the leadership level at Apollo, which initiated this sort of very, really very, very prescient investment into this system? Because telemedicine before the pandemic really had a lot of, had a hard time going mainstream.
So we have been working on various pieces. So our personal health record is something we've been doing for the last 8 to 9 years, because we strongly believe that the customer should see his entire health journey and doctors should understand the continuum of care. So the personal health record was our consolidation of all events of care, whether it was in diagnostic or home care or outpatient clinic, or the patient had a bypass surgery or a heart transplant. This record keeping started us off with a base of almost 8 million records. Then our pharmacy chain was serving multiple customers. We needed an online platform, as was our diagnostic chain. So we put all this together along with the core platform. We've been working on telemedicine for almost 20 years. So the combination of teleconsults, online ability to order medicines and diagnostics, and store your records. We're now moving further into using this data, but to proactively build artificial intelligence-based models to prompt people into appropriate health behavior. So I think there's a tremendously exciting journey ahead for 24/7 and the use of technology in healthcare at large.
And is 24/7 and developed completely internally, or were you using off-the-shelf solutions and then integrating them into into the solution?
So actually, it's been developed completely internally using our own tech solutions and putting them together. Of course, we're working with partners like Microsoft. We're talking to Google on various things that we're doing in the AI side. There's a lot of these kind of partnerships, but it's a core technology that we own and has been built for us, but we're also exploring methodologies to share and license.
And so it seems to be built in terms of Apollo strategy, that some fraction of your resources is always devoted to research and innovation.
So
your own internal development of your own internal innovations. Would that be correct?
So this is absolutely correct, but I think in digital transformation journeys, the use of various tools, AI, AR, VR, virtualization, deep tech, there's so much to be done. And genuinely, we do have partnerships. So let me say that two of our AI partners include Zebra from Israel, as well as another UK partner. So we have various pieces which do come from partners which are now getting plugged into 24/7. Right now, they're operating in the hospital environment where we have these partnerships, but they will soon have their own representation across the platforms. So the COVID-19 symptom checker, which we built, I think is a very good example of something that our own in-house team use the knowledge of our doctors, use the kind of patient interfaces that we have, and help put this together.
So and again, I'm assuming that that's part of overall approach to innovation, that you do some internal internal development on the one hand, and you take solutions from outside on the other. So if a startup had an interesting solution for Apollo, for instance, what are some of the challenges that it might face? I mean, what is needed if for a startup with a new solution? What does it take for it to surface up to a point where a decision can be made?
I think that's a really great question, and I think that we are definitely open to working with startups, either to plugging in their solutions into our overall platform, working separately with them for their solutioning capacity within our environment. And in some areas, we've also done acquisitions or investments. We also have an investment accelerator arm, which looks at healthcare investments through startups and in technology. And it's actually based out of Singapore. It's in partnership with Jungle Ventures.
Right.
So it's actually based out of Singapore. So I truly acknowledge the tremendous space that Singapore is having in moving technology into healthcare.
But coming back to Apollo 24/7, so you developed this solution. I mean, what were some of the challenges that you faced when you wanted to roll it out? I mean, in the implementation.
So clearly, doctor adoption was one of the single biggest challenges, because doctors are so used to having patients come into their office rooms and they are saying, if this patient hasn't even come here, why do I need to see him? And, while we've been working with telemedicine for over 20 years, we launched the first telemedicine in the year 2000 when Bill Clinton visited India, and we connected my father's village to an advanced hospital. And the CT scan, the echo machine, all these were connected so that doctors who were sitting in the city could interpret, because you can buy high-end machines and put them in rural India, but it's very difficult to have doctors to go and live there. So telemedicine for a long time was a methodology to bring rural India under some kind of healthcare coverage. However, now I think its uses have just grown multi-fold and increased. So the pandemic really made doctors say, hey, patients aren't able to reach us. This is our way to reach them. So the adoption grew over 2,000, 3,000 times during that first 5 to 6 months of the pandemic. Once the pandemic eased out, we saw about 20 to 30% of patients coming back into the physical environment. But those who had understood the value of online consults, now the health-seeking behavior started changing. So a patient comes in to see a doctor for the first time, but for follow-up care, once they've already done one physical visit, they say, hey, why can't I do a teleconsult? So I think some of these changes are here to stay permanently. And it's for us to re-engineer our healthcare systems to incorporate convenience, while at the same time staying very clear about patient confidentiality, the quality. So we follow HIPAA standards in all the technology that we use, so that we're safeguarding the environment. We also don't really like casual phone conversations. So we encourage our doctors to use the technology platform, even if it's for a phone consult or a full-scale video consult, because then the interface is recorded, is documented, has the backup of the health record for the doctor to refer to. And so this type of behavior is also increasing within our ecosystem. While I do know that all over the world, right now, because we're in a pandemic, just connecting doctors to patients is appropriate. But over a period of time, I think using the right platform is important.
Yes, no, indeed, because there's, there are also a lot of things as a clinician you can't do, talking to a patient remotely. So have there been, convenience is great, connection is great, but have there been any pitfalls? Have there been any, what are the major issues, using a telemedicine?
Yeah, I think so many things that I wish we had done better and faster. So now we're using devices to connect the patient, SpO2, blood pressure. We can connect those go automatically into the central tech. The doctor can see it on the screen, but we didn't do enough. So handling, almost 2,700 patients with COVID. If I had had enough devices and every patient was connected, the staff intervention for those COVID positive patients would have been far less. But we don't even have enough devices because we never expected this kind of scale or proliferation. If I could put this device into, every patient who's having home care, then the ability to see, we have about 400 patients who are connected on these devices in home care, but I wish we had done more. So I think the lack of scale is one very important thing. The training program to getting our own teams also completely used to and conversant with the technology is one more. But I think so far it's actually been a very powerful journey. And I think in addition to AI, the Internet of Medical Things and analytics, the combination of these three is going to be transformational when it sits on top of the connectivity bandwidth. So I really foresee that the next decade is one of tremendous transformation in the healthcare sector using technology.
And okay, I see a first question popping up for you. So I'm just gonna, just so we can get our audience on board, let me just take this question from Jenny.
And I truly appreciate your patience and the indulgence of our other speakers to allow me to do this and move fast. So I really appreciate the format.
No problem. We also appreciate the situation you're in. But here's the question from Jenny W. to Dr. Sangeeta. Are there any accelerated developments in your collaboration with startups in developing solutions to handle the existing situation in India? I suppose in many ways, okay, are there examples of accelerated developments in your collaborations? How do you accelerate collaborations with startups? I suppose that's in summary, that's the question.
So we have a separate division But right now, as you can understand, everybody is really deluged with various things. I think one interesting startup or innovation or science which has moved during the pandemic is that CCMB, which is the Center for Cellular Microbiology in India, came up with a new RNA extraction methodology, which enhances which reduces the time for the RT-PCR test. So CCMB approached us, our doctors and our diagnostic team validated the methodology. We then partnered with the lab diagnostic kit team. So we've gone into production mode on that. ICMR, which is the Council for Medical Research, is validating this technology. We're expecting in the next 2 weeks it'll be out in the market. And whoever uses it can reduce the RT-PCR testing time cycle by almost 2 hours. So this is one example. There are various others. So technology firms that we have been working with pre-pandemic on the devices, all those really got accelerated during the pandemic so that we could scale up further. And we are really open to partnering or to exploring. I don't know how much time our teams will be able to give right now, but the company or the separate entity is called Apollo Research Innovations. And I will be happy to later share the CEO's number and email ID so that any of you can connect with her. She is truly the funnel. We are currently looking at different devices to sanitize or look at rooms. We're talking with the Israeli company called Sanotize, who have this nasal spray to protect someone. There's an Indian company called Citadel Healthcare, which has created a mask with a breathing device at a very low cost that we've given to our own healthcare people who are inside the COVID ICU. So various things have been happening in parallel, not as much as we would have liked, but I think many of these have been quite significant.
But from your perspective, okay, you talked about with now you're now able to engage your patients using a telemedicine platform. You talked about how you see the power of analytics going to play an important role. But outside, and you just touched on something that was a little bit less digital in terms of the ability to more quickly handle mRNA for testing purposes. But from a needs perspective, right now, where you are, so as you confront this new situation in India, what do you wish you had more of outside of these two? Is there anything else? You know, for instance, would you see a COVID-19 breathalyzer test? How important would that be? Would that make a radical difference? Are there other?
I would be extremely happy if we could find a way to do a breath analyzer test, because we could use it in wide-scale screening. We could screen patients who are coming into the hospital. We could share this with governments for airports and railway stations. I would do whatever we can to partner with someone who is working on a breath analyzer test, which will enhance the speed of detection and therefore allow us to trace, to isolate anyone who is COVID positive, and therefore help bring the pandemic under control. So it would be transformational. We're very excited and happy to talk with someone if that technology exists.
There is another question here from Yan Bing. Can any innovations in the hospitals be applied to the social setting in India to better manage COVID? I'm not quite sure what it means, but maybe if Yan Bing will allow me, let me just modify this question a little bit and ask Dr. Reddy, how do you interact with the public sector?
So with the public sector, honestly, at the beginning of the pandemic, I was also president of FICCI. So I had a platform through FICCI with multiple interactions with all segments of the government, and the government is doing a lot. So we shared, Apollo Hospitals created, using our doctors, our pulmonologists, our infectious disease specialists, we created a COVID protocol because our 2,700 beds dedicated to COVID and the home care protocol and the fever clinics and the screening and the online consults, we wanted the best possible treatment protocol. So we created a centralized protocol and we shared that with the government, with other nursing homes, with the PSUs who had hospitals, with corporates in terms of their own screening protocol, sanitization. How do you trace? How do you isolate? If someone has, the symptoms, how do they go ahead for testing and immediate self-isolation even before the report comes? So all these were put into a protocol and shared, and I think this was one of the engagement models. But besides that, we also spoke about how do you ramp up? What is the support they would give us in terms of, the hotel environment, the standardized pricing protocols, so that there was no opportunistic use of the pandemic, because many people in India can't afford, and most people are paying for treatment out of pocket. So there were many areas of engaging with the public sector and partnering, and I know that they were trying to scale up. We also did a lot of volume estimates, and this was through FICCI, in terms of need for medication, methodology to partner during the vaccine. Now we're in deep talks on oxygen and how do we scale up the oxygen capability? Where is the crux of the problem? India actually doesn't have an oxygen production problem. We have enough oxygen, but much of it is used in the industry. So when the government reached out to the steel industries and said, hey, redirect your oxygen capability into medical grade oxygen, that opened up. But now what we need to do is transportation. So this dialogue with government, a proactive government, is enabling us to find solutions quickly. And I am, while I'm worried about the current situation, I continue to remain hopeful that we will very quickly, once again, bring this second wave under control. We assume as a public health specialist that it's going to get worse before it gets better. But our speed of response, the infrastructure and the framework for vaccination, the ability to ramp up a lot of our treatment capability, are bringing in more doctors into the ecosystem and nurses. So yesterday, we actually had the opportunity to request our Honorable Prime Minister to waive the nursing exam so that 60,000 nurses can be brought into the workforce immediately. So various things like that is where dialogue with governments enables the public and the private sector to scale and ramp up.
So thank you for that, Dr. Reddy. You also partially addressed a question by Annie Fang, who had asked about how you were going to address the situation with the shortage of oxygen. But she also had a question on how you plan to address the shortage of beds. Maybe a few quick words on that before we
Yeah, I realize it's a deep subject. Sorry, I'm taking so much time. But basically, it's the shortage of beds. We're doing multiple things. Like I told you, the hotels are being converted into supervised rooms, medically supervised rooms using telemedicine and the mobile network. And India is really blessed with a very powerful mobile network. So communication and connectivity is fairly effective. The government is also encouraging large beds to be placed very close to hangars, or to be placed close to oxygen supply. Because as we all know, if we can give oxygen and the right medication in the first 5 to 10 days of the pandemic, someone contracting COVID, then we're able to treat them very effectively. So multiple methods like that to scale up. So stop elective surgery, dedicate more beds to COVID, create more bed capacity, convert hotels into beds. All these are part of our initiatives to ramp up.
Thank you, Dr. Reddy. And I think in the light of what you're going through right now, feel free to leave. Thank you for joining us today. Your insights were invaluable. Really, really thank you for that.
I appreciate the opportunity. Namaste, and my special thanks to Kenneth for being so understanding. and to you, Dr. Lim. Appreciate it and all the best. And my offer to connect and collaborate with startups absolutely remains. We have a great belief in the power of innovation through startups. All the best. Thank you. Namaste.
Thank you, and all the best. Okay, Kenneth, your turn.
I feel like this is a job interview, is it, G? Yeah.
No, actually, for the benefit of the audience, I should say that just a few weeks ago, I had also met up with Kenneth to talk about some of these issues here. But I think it's useful just to share the conversation with the audience. And of course, we have a few other questions here. So let me just get the ball rolling again. From your perspective and from the SGH perspective, what were some of the most impactful and effective innovations for you in the past year as a result of the pandemic that you've actually deployed?
Sure. So, it sounds really blasé to say this, but I actually think that a lot of it boiled down to data and analysis of the data. So what I feel was actually the most impactful thing was the way Singapore tried to, and I'm not for a moment suggesting that we've solved all the problems and we have all the answers, not for a moment. But what I found very helpful was that we were able to get the data, and looking at the data, we very, very quickly recognized that once we reach a certain, because Singapore exists, our public healthcare system exists, and I don't use this word casually, almost on a knife edge, because almost every day, even before the pandemic, all our hospitals run at between 90 to 96% bed occupancy before the pandemic, right? And we recognized very quickly that once the pandemic takes root and we have a certain number of cases, our healthcare system will be overwhelmed very, very quickly. So we had a lot of modeling done, a lot of projections done by our data analysts, both at ministry level, government level, as well as in the hospital. And we tried to chart out which were the specific resources that we needed. Beds, quite obviously, emergency screening areas, obviously, quarantine areas for the patients, intensive care beds, equipment for the intensive care, manpower to man all these various areas. And then we tried to ramp up the capacity as best we could. We realized that there was a limit to the amount that we could ramp up. So we actually had to find alternative sources, and that's where government and ministry stepped in, and we created the community care facilities, the swab isolation facilities within the hospitals, the community care facilities. So all these actually came in. We tried, we weren't always able to, but we tried to remain half a step ahead of the demand, and we tried to have that capacity ready. We were not always able to, and there were times when we were at risk of being overwhelmed, but I dare say it was that forward planning, that very clever use of data to actually plan and get things ready. Yeah.
But did you already have this analytics team?
Yes. So we
did together.
Yes. So actually, we went through a very bitter lesson, and this is an even more bitter lesson over the last 12 months. But we went through a very bitter period in 2003 with SARS, and following SARS, in the 5 years following SARS, at hospital level and at ministry level, there was a very determined effort to ensure that we would be much more ready if we ever get hit by a pandemic again. So we built up a lot of isolation facilities and all the other capacities, but we also built up the analytics team. We built up epidemiology teams within SGH. We built up a team with data analysts. I wouldn't say data scientists, but data analysts. And within the Ministry of Health, they also formed an epidemiology and data analytics team. And we work quite closely together, because government has access to much more data beyond the healthcare system. Yeah.
So like we heard from Sangeeta earlier, is there also an equivalent sort of an Apollo 24/7 at SingHealth? I mean, are you also seeing more patients using a telemedicine platform?
I must say I listen with some degree of envy, right? That they have a platform like Apollo 24/7, because it sounds very integrated and very holistic. And we are now trying to bring together various threads that we have in existence. So the last 8 to 10 years, we actually have built a platform. It's a patient engagement portal, which we call Health Buddy. It predated Health Hub, which is the national platform, but the Health Buddy within SingHealth is for SingHealth patients, and that's where they can pay. And we've built up the functionality gradually. It does not have telemedicine and video conferencing facilities, but that's where patients can go in, make appointments, change appointments, check their results, and things like that. We've been building in more functionality where patients, what we've been looking at even before the pandemic over the last 6 years was we have a team looking at what we call the future outpatient journey, where we envisage a seamless journey where patients come to the hospital. Currently, the current model is patients come in, they register, they take a queue number, and they sit down and they wait. Maybe 30 minutes, maybe an hour, maybe 2 hours, unfortunately. Then they go into the room, see the doctor, have the consultation for 10 minutes, 15 minutes, as the case may be, come out, they wait again, make payment, make the appointment, get their medicine, and then go home. That whole turnaround time is ridiculously long. Can be anywhere from 2 hours to 4 hours or 6 hours. And it's all unnecessary. So we envisage a situation where patients come in, go straight into the doctor's room, see the doctor, and just go home. Right. So we're getting close to that. We have a mobile registration platform where patients can register while they're at home, while they're on the bus on the way to the hospital. Their queue number is sent to them, and they are informed how many patients are ahead of them before they get to see the doctor. They come into the clinic just before their time their turn is to see the doctor. And we have what we call a drop and go and a medication delivery service, where once they come out of the clinic room, they indicate to the clinic staff that they want to just walk off, and they go off, and everything is done online with them. So they're sent an SMS of when their next appointment is. They're given an invoice. They can make payment online through any of the electronic payment portals. So that was in existence previously. Uptake wasn't so strong. The patients just wanted, but the uptake for medication delivery and the drop and go service soared during the pandemic and the circuit breaker, because we were pushing to reduce the dwell time in the hospitals. So the uptake went up from 6 to 7% to close to 60% now. Right. So we have that portal. Yeah.
Sorry, I missed it. I couldn't catch it earlier, but did you say Health Buddy does have a telemedicine platform as well?
So it does not. So what we do now is Health Buddy does everything else that I mentioned, but it does not have telemedicine. Our telemedicine is done through Zoom, which is great for meetings, but it's a bit clunky for teleconference, for telemedicine. So we are now looking to see, so we're trying to link the two, and we're trying to find a nice platform that can be mobile, that patients will be able to easily access. One of the challenges is that in public healthcare, the challenges of cybersecurity and making sure that the system is safe and encrypted and things like that. Yeah.
Why not just use one of the existing providers? There seem to be quite a few.
So
that have.
So that is something that we are looking at as well, and we're close to that option either. I mean, there are providers like White Coat, like SpeedDoc, like Good Doctor, and things like that. one of the challenges is because we see ourselves as an integrated system, we need to be able to have, I wouldn't say control, but some oversight on the clinical governance and the practice standards of the various providers. So we just need to be able to ensure that there's consistency in practice, the referral flows are appropriate, so even though they're not part of the organization, we feel that there would still, we still have to ensure that there's a certain degree of clinical governance there. Yeah.
Well, I suppose it's hard to say when this pandemic will finally blow over. So it does look more and more like, there's some kind of a new normal. And from that perspective, what else, what other gaps would you like to fill with technology? Whether to reduce, to increase, to increase turnover, which is to reduce, or to minimize contact. Are there, what do you see as technologies that are going to?
So I can resonate entirely with what Dr. Sangeeta said earlier, and I think they have done tremendous work. I think the best care is actually when the patient doesn't need to come to the hospital. If we can move upstream and keep the patients well, keep them at home so that they don't even need to come to the hospital. Ultimately, I see myself as we put hospitals out of business, right? So that you reserve the hospitals only for the most critically ill, for the most complex cases. But if we can develop systems to move the care upstream, deliver care at home, monitor patients effectively at home, then I think we would have gone a long way. This requires very good sensor technology, very good data transmission, very good data visualization platforms, and critically it has to be integrated. So it's very, I feel we have nice little pieces. There's this solution for remote monitoring, there's this solution for dashboarding, there's this solution, but it has to be all integrated together into the hospital system so that everything can talk, and it must be able to interface with new technologies that come along and new solutions such as artificial intelligence, such as data analytics and other new sensors, because right now we're looking at our medical sensors, but subsequently there's going to be a lot more data that is going to be person or patient generated, which is not really hospital and medical data.
But do you think we're anywhere close to replacing the physical examination? I mean, if someone sees you on a telemedicine consult for a child who's breathless, I mean, there's just no way you can ever, there seems to be limits. Do you see components that can gradually, of the physical examination that can be gradually replaced by new sensors, and what might that look like?
Sounds a bit odd because I sort of oversee innovation and transformation, but I am somewhat of a traditionalist when it comes to clinical medicine. And I would fight quite hard to totally push for entirely remote care. I think there's tremendous value in laying hands on the patient and actually doing a thorough physical examination. I think we are some ways off from developing a technology, be it a robotics with artificial intelligence and analytics, which can replace the clinical acumen built up over years of clinical practice. So I think we are making a lot of headway, and I think there's a balance to be struck. We certainly shouldn't turn our backs on any of the new technologies and the new sensors. I mean, there are all sorts of new electronic stethoscopes, self-directed ultrasounds, fetoscopes, and machines which actually listen to fetal heart rates and things like that. We should embrace these, but they become complementary to our clinical evaluation and clinical assessment. I think there are certain groups of patients who would be able to benefit from remote care, particularly follow-up consultations. However, for first visits, that first consultation, I do feel that there is quite a lot of value in having some degree of physical interaction. Yeah.
Thank you. It looks like we have a question for you, a few questions from the audience. So the first one is from Fiona Setiawan. Dr. Quek, in view of the stringent requirements on data privacy, how open are you in partnering more closely with private players in the more sensitive areas? For example, to better integrate hospital operations and workflow, cutting edge telehealth. All right, how do you deal with, what are your considerations when you work with the private companies in relation to privacy?
I hand on heart, I'm totally open. I would welcome opportunities to explore new ways to work and new ways to transfer data and interface systems and things like that. Personally, I think that we have swung a little bit too far in tightening our cybersecurity controls at the expense of collaboration, data transfer, and effective use of our data. I think there are occasions where we stray a little bit too far. I'm not for a moment suggesting that we can disregard cybersecurity concerns, not at all. However, I do think that the approach that we should take is we should be able to tier the data such that even within a hospital system, there's some data that's less sensitive. There's some data that can be anonymized. Once we are able to remove the sensitivity of the data, that data should be able to be shared quite more openly, more freely, not made public, but at least without all the very, very stringent controls. But for the most critical data, once they're patient identifiers and things like that, then everything has to be very strictly locked down. But I think we're moving towards tiering our data such that, that there's going to be more free flow of data for anonymized and less sensitive data.
But in general, how would a company from the private sector rise above the noise to become a signal that you say, okay, all right, what you're doing is interesting, and once what's the pathway at SGInnovate for someone who has a solution to get noticed, and after you get noticed, what are some of the hoops that one should expect to jump through before as a system you say, all right, I'm going to use it?
So I think first and foremost, there must be impact. I mean, whatever solution is put to us, we are very keen to ensure that there is meaningful impact. I'm always very cautious about gimmicky, gadgety things which look very good and sound very exciting, but when we drill down, we want to see, is it really going to have an impact? And that impact can be measured in several ways, right? Does it enhance productivity, efficiency? Does it reduce costs? Most importantly, does it improve outcomes for our patients? Does it make the care safer? Does it improve the experience for our patients or for our colleagues, our staff, right? So as long as there's impact, we are very interested. And I think sometimes that's why what we try and do in SGInnovate is we try and apply an academic approach, not academic in an ivory tower academic way, but really look critically at the data, at the information to assess what is the outcome that we achieve with this new solution and before we had the solution. We can develop that, then we need to look into the value equation of what is the investment that's going to be needed, and does it make value, does it make sense for us to invest in this platform or solution? So as long as the impact of the outcome is there, we can show value, then we need to work through all the other technical issues. And it almost always can, I must say, although it sometimes is a little bit challenging. Some of the issues we are not entirely in control of. Yeah.
I mean, so there was a question from Ray Pitraj, which was very much along these lines. But, is there a guide? I mean, are there some things, are there specific outcomes that you really, really want to address that are in the public domain as a need statement that allows startups to attempt to address?
Certainly.
So I think I have a solution. Let's go check it out at SGInnovate.
Sure. Yeah. So I actually there was a question earlier about are there any innovations that were developed in Apollo that can be translated outside of the hospital into other sectors, into the public domain? In my mind, I actually look at it the other way. I think there's a lot of technology, there are a lot of solutions in other industries that have not yet been translated into healthcare. Because I think what I realize increasingly is that apart from our clinical enterprise, the clinical care that we deliver to our patients, our doctors, our nurses, our allied health professionals looking after patients, we are just a very large enterprise where we still have a kitchen to run, we've got a linen service, we've got a MMD department, the supply chain, we've got drugs to deliver, we've got all the other systems. And I think that a lot of those areas, we are in healthcare, in hospitals, we haven't yet harnessed what other industries take for quite routine practice. We've been a little bit slow to adopt them in our non-clinical part of the enterprise, our operations side. For our clinical enterprise, yes, certainly. I think anything that enhances patient safety. So we're very particularly looking at any of the data analytics and artificial intelligence pieces that look at things particularly at radiology, for example, digital pathology. SGH is moving towards a full digital pathology where all our histopathology slides will be digitized. So we won't be looking at glass slides. Everything is on a computer screen. There are huge opportunities to, I think, develop artificial intelligence for image analysis, for screening, for triaging, for diagnosis, for exclusion of specific conditions. Right? So looking at chest x-rays, can we exclude fractures of the rib? Can we just say that this chest x-ray is normal? You don't need to tell me what's not normal. Just tell me, is this normal? And that's like probably 80% of all the chest x-rays. Then no one needs to look at it, right? Yeah. So I think these are some of the opportunities that we're excited about. And of course, automation. There are many areas that we haven't yet automated.
Kenneth, our time is almost up, but I thought, when we met a few weeks ago, you had talked about a new joint institute for medical innovation. I can't remember the name of it.
That's right.
I thought maybe this might be a good opportunity to share this with the audience so that they know about it.
Sure. Thanks very much, Jui. So yes, you're right. So just give you a little bit of a landscape background. Within SGH, within SGHealth, we have innovation offices. We are building a physical innovation center, which will be ready towards the end of this year. Those are part of our healthcare service enterprise. Our academic partner is Duke NUS, all right, which is itself a partnership between Duke in North Carolina in the US and National University of Singapore. So this is a partnership between SGHealth and Duke NUS coming together to form what we call an academic medicine innovation institute. So we're bringing together the academic side, and they will bring in the impact assessment and the more academic rigor of assessing the various innovations and transformation projects that we are involved in. This is critical because we need data. We need published evidence. We need sound evidence to convince people of the value and the impact of the innovations that we put in place. Otherwise, people will not adopt it and people won't scale the innovations. So this is one of the key things that we're progressing on.
Would that be the principal portal through which providers of solutions, they should go there first and say, look, this is something that we have?
So we actually have a no wrong door policy. So we realize that there's a continuum between research and innovation. So we have a very active research enterprise. But when we come to the research side, if they feel that, hey, this isn't really research, it's actually a little bit more on the innovation transformation piece, they will hand over and our team will take over. Similarly, if you come into the Duke NUS side, if they feel that, hey, it's better managed at the clinical side, we will also, whichever door you come in, we will all come in, but feel free, you can come into the SGInnovate innovation transformation space, you can come in through the Duke NUS space, you can come in through the SGInnovate research space, you can come in through the SGInnovate quality improvement space. It doesn't matter. We are bringing everything together, right?
Thank you so much for that, Kenneth. And I think we've kind of run out of time.
Sure.
So please allow me to once again thank you for joining us today. And I hope I'm certain the audience found this very, very useful. Navita, is there anything you would like to say before we end the session?
No, I would just like to thank you and Kenneth for joining the session and leading the session today. And on behalf of FICCI and on behalf of Dr. Sangeeta Reddy, again, thank you so much for considering her request. I think it's a tough time in India currently. And while we had planned the session much longer in advance, about a month and a half ago, we were not expecting that we will be in such a state today. So unfortunately, we couldn't really go ahead as planned, but thank you so much for your patience, and also a big thank you to the audience for their patience and giving us the time today. And we look forward to doing more such dialogues in the future. Thank you so much.
Thank you. Please send Dr. Reddy our best. Yeah, on behalf of everyone.
Absolutely. Thank you. Thank you.
Okay. Thank you, and have a good day.
You too. All of you.
Thank
you.
Bye-bye.
Thanks,
Navita. Thanks, Jui.
Bye.
Take care now.